Welcome back to the Best PT Podcast. This is episode 32, Physical Therapy Practice Standards. General practice standards consider legal and ethical considerations, administration of physical therapy service, patient-client management, education, research, and community responsibilities. APTA core values: accountability, the active acceptance of the responsibilities of a physical therapist; altruism, devotion to the interest of patients and clients; compassion and caring, concern, empathy, and consideration for the needs of others; excellence, the consistent use of knowledge and theory to embrace advancement, challenge mediocrity, and work on development; integrity, steadfast adherence to high ethical standards; professional duty, meeting the obligations to provide effective physical therapy service to patients and clients, serve the profession, and influence the health of society; social responsibility, promotion of mutual trust between the profession and the general public. Code of ethics. Principle 1 says that physical therapists shall respect the inherent dignity and rights of all individuals. Principle 1A, physical therapists shall act in a respectful manner towards each person regardless of age, gender, race, nationality, religion, ethnicity, social or economic status, sexual orientation, health condition, or disability. Principle 1B, physical therapists shall recognize their personal biases and shall not discriminate against others in physical therapist practice, consultation, education, research, or administration. Principle 2 says that physical therapists shall be trustworthy and compassionate in addressing the rights and needs of all patients and clients. Principle 2A, physical therapists shall adhere to the core values of the profession and shall act in the best interests of patient and clients over the interests of themselves. Principle 2B, physical therapists shall provide physical therapy services with compassionate and caring behaviors that incorporate the individual and cultural differences of patients and clients. Principle 2C, physical therapists shall provide the information necessary to allow patients or their surrogates to make informed decisions about physical therapy care or participation in clinical research. Principle 2D, physical therapists shall collaborate with patients and clients to empower them in their decisions about their own health care. And Principle 2E, physical therapists shall protect confidential patient-client information and may disclose confidential information to appropriate authorities only when allowed or is required to by law. Principle 3, physical therapists shall be accountable for making sound professional judgments. Principle 3A, physical therapists shall demonstrate independent and objective professional judgment in the patient-client's best interest in all practice settings. Principle 3B, physical therapists shall demonstrate professional judgment informed by professional standards, evidence, including current literature and established best practice, practitioner experience, and patient-client values. Principle 3C, physical therapists shall make judgments within their scope of practice and level of expertise and shall communicate with, collaborate with, or refer to peers or other healthcare professionals when necessary. Principle 3D, physical therapists shall not engage in conflicts of interest that interfere with professional judgment. Principle 3E, physical therapists shall provide appropriate direction of and communication with physical therapist assistants and other support personnel. Principle 4, physical therapists shall demonstrate integrity in their relationships with patients and clients, families, colleagues, students, research subjects, other healthcare providers, employers, payers, and the public. Principle 4A, physical therapists shall provide truthful, accurate, and relevant information and shall not make misleading representations. Principle 4B, physical therapists shall not exploit persons over whom they have supervision, evaluative, or other authority. Examples: patients and clients, students, supervisees, research participants, or employees. Principle 4C, physical therapists shall discourage misconduct by healthcare professionals and report illegal or unethical acts to the relevant authority when appropriate. Principle 4D, physical therapists shall report suspected cases of abuse involving children or vulnerable adults to the appropriate authority, subject to law. Principle 4E, physical therapists shall not engage in any sexual relationship with any of their patients or clients, supervisees, or students. Principle 4F, physical therapists shall not harass anyone verbally, physically, emotionally, or sexually. Principle 5, physical therapists shall fulfill their legal and professional obligations. Principle 5A, physical therapists shall comply with applicable local, state, and federal laws and regulations. Principle 5B, physical therapists shall have primary responsibility for the supervision of physical therapist assistants and support personnel. Principle 5C, physical therapists involved in research shall abide by accepted standards governing the protection of research participants. Principle 5D, physical therapists shall encourage colleagues with psychological, or substance-related impairments that may adversely impact their professional responsibilities to seek out assistance or counsel. Principle 5E, physical therapists who have knowledge that a colleague is unable to perform their professional responsibilities with reasonable skill and safety shall report this information to the appropriate authorities. Principle 5F, physical therapists shall provide notice and information about alternatives for obtaining care in the event that the physical therapist terminates the provider relationship while the patient or client continues to need physical therapy services. Principle 6, physical therapists shall enhance their expertise through the lifelong acquisition and refinement of knowledge, skills, abilities, and professional behavior. Principle 6A, physical therapists shall achieve and maintain professional competence. 6B, physical therapists shall take responsibility for their professional development based on critical self-assessment and reflection on changes in physical therapist practice, education, healthcare delivery, and technology. 6C, physical therapists shall evaluate the strength of evidence and applicability of content presented during professional development activities before integrating that content or technique into practice. 6D, physical therapists shall cultivate practice environments that support professional development, lifelong learning, and excellence. Principle 7, physical therapists shall promote organizational behaviors and business practices that benefit patients and clients and society. 7A, physical therapists shall promote practice environments that support autonomous and accountable professional judgment. 7B, physical therapists shall seek remuneration as is deserved and reasonable for physical therapy services. 7C, physical therapists shall not accept gifts or other considerations that influence or give an appearance of influencing their professional judgment. 7D, physical therapists shall disclose financial interests they have in products or services that they recommend to patients and clients. 7E, physical therapists shall be aware of charges and shall ensure that documentation and coding for physical therapy services accurately reflects the nature and extent of those services provided. 7F, physical therapists shall refrain from employment arrangements or other arrangements that prevent physical therapists from fulfilling professional obligations to patients and clients. Last one, Principle 8, physical therapists shall participate in efforts to meet the health needs of people locally, nationally, and globally. 8A, physical therapists shall provide pro bono physical therapy services or support organizations that meet the health needs of people who are economically disadvantaged, uninsured, or underinsured. 8B, physical therapists shall advocate to reduce health disparities and healthcare inequities, improve access to healthcare services, and address the health, wellness, and preventative healthcare needs of people. 8C, physical therapists shall be responsible stewards of healthcare resources and shall avoid overutilization or underutilization of physical therapy services. 8D, physical therapists shall educate members of the public about the benefits of physical therapy and the unique role of the physical therapist. That's it for episode 32 on physical therapy practice standards. Episode 33, we'll talk about health insurance. As always, the outline will be in the show notes. Thanks for joining me.